You are amazing.
Just awesome.
It's fantastic every single time I see it. I'll see it again and again and again.
He's 5-star in my book.
Talk about someone who exudes empathy. She just delivered the wow factor. My first 3 seconds of meeting her was just absolutely amazing.
Now Maslow said this, that security is to know your surroundings and know what's coming next. So where in all the world are you most comfortable? Tell me. Home, exactly. I'm most comfortable at home where I know where everything is and what every sound is. I'm in my easy chair. That's my ice maker dropping ice. That's my dog snoring. That's my husband snoring. That's my generator, goes on every Tuesday at 12 or 15 minutes. I know all those sounds. I know everything that's going to happen in my house. So what could be more of a threat to someone's security than when we take a patient, we put them in a place called a hospital and we dictate everything that's going to happen, and they have no idea what looms around every corner. What could be a bigger threat? It's low on the pyramid of needs. Moving up, he said all of us want social esteem, and at the very top, self-actualization. He described it as this, living out our potential here on earth. I like to say it just a little bit differently. I like to say it's when our mind and our heart and our hands all align to do the very thing that you were put on earth to do. So how many of you feel like you're self-actualized in your current job? Now, if you're sitting next to your boss, just go ahead and lie and raise your hand, but like, this is what I was born to do. Wow, I said thing, the very thing that you were born to do. For some of us, it's not our job. For some of us, it's work we do in the community, work we do in the world. So my husband and I have a mission in India where we take girls off the streets and out of factories, and we actually train them to be nursing assistants, forever changing their lives and the lives of their families going forward. Sometimes it's work you do in the world. Sometimes it's raising children. This is what I was born to do. Maybe not. Sometimes it's being a grandparent. Any grandparents in the room? I hear it's good, isn't it? There's a look that comes across people's faces when you say the word grandparent. And I'll tell you, I'm really happy for you, but it makes my husband and I kind of sad because no one will marry our children. So don't come up after and show me pictures on your iPhone, whatever. Thrilled for you. So I thought this, as I sat in the conference, I said, you know what? If people have needs, certainly patients have needs. Would you agree? Give me an amen. Amen. Their needs have needs. And so what I did as I sat at the conference is this. I put them on a hierarchy of needs. Now, this is the general patient. If I were to ask you what your specialty or subspecialty is, you could take Maslow's pyramid and you could specialize it to your patient. That's actually some of the work that we do with organizations. At the very bottom, I believe that every patient wants a bed. Would you agree? Anyone here representing the ED in any way? Anyway, oh, we have a physician in the back of the room. Hold tight. Hello? Colleen. He's changing his name already. This isn't a good start. I'm going to ask you a question, not to put you on the spot or anything, but be totally honest with me. Has there ever, are you right here at this hospital? Hartford Hospital? Okay. Has there ever been a time in the history of Hartford Hospital where a patient has come in through your emergency department, you evaluated them, it was thought to be that they needed to be admitted, but there was not a bed available? Has that ever happened? Never. Thank you for your honesty. It's never happened here. Well, let me tell you about the way that it happens in other organizations. Sometimes that happens, Harry, Dr. Harry, fake name that he's giving me. And we take a patient, we put them on a gurney, and we put them out in the hallway. The last organization I came from, which was an excellent one, sometimes for 18 hours. Then we would admit that patient, We would treat them, discharge them, and 3 days later, we would send them a survey in the mail and say, did we wow you? No, a bed would have been really nice. It's low on the pyramid of needs. Every patient wants a bed. Patients want nutrition, they don't want bad hospital food, they want rest. Maslow said that we want sleep. Patients need rest. They actually need both. Sleep can come from a pill and rest never does. It's why the government asked that question on a survey. Was it quiet around your room at night? Knowing that patients who get adequate rest will be discharged and heal 40% quicker. Rest is so important, and patients rarely get it.
I've seen hundreds of presentations. Never have I been touched or moved so much as I have by Colleen. Phenomenal.
She was absolutely fantastic.
I loved Colleen's presentation, and I am ready to take it back. She has an amazing way of taking something that's really very complex and making it simple enough for all of us to understand.
I just loved your presentation. It was so wonderful. Listen, I came out of this with, I'm sitting there and my mind is spinning, like thinking, like these ideas are just popping in my head. That just gave me an idea. Okay, we gotta, okay, that just gave me another idea. I gotta write this down. And